Today's video is a must-watch for anyone dealing with lower back pain. We'll be covering 3 essential SI joint stretches and exercises to relieve that discomfort. So if you've been struggling with SI joint pain, make sure to stick around to the end. Let's dive in. Hi, I'm Dr. Lane Palm, chiropractor at Onnit Gym in Austin, Texas, and 96 kilogram national champion weightlifter. If you like this video, please give it a thumbs up and subscribe to our channel for more. The SI joint is a very common culprit for lower back pain. So the SI joint is the articulation between your hip bones and your sacrum, so these 2 joints on both sides of your hips. So the joints are very tightly wound together with ligaments, but they are designed to move slightly as we move through our daily activities, such as walking, running, hinging, and squatting. Many factors can predispose a person to SI joint pain. So the most common causes of pain in this joint typically result from things like leg length discrepancies, gait abnormalities, consistent strain from lifting, low-grade stressors from working out or sitting, and more serious things like scoliosis of the spine or pregnancy while carrying a child. Specifically in regards to working out and lifting weights in the gym, we tend to overdo movement in the sagittal plane. This can easily overload the SI joints and cause compression that leads to that irritation. Think of the sagittal plane as going vertically from front to back. So this includes movements like our traditional hinge pattern exercises, such as deadlifts or kettlebell swings, and as well as our squatting movements. These movements are all amazing and should definitely be staples in our training programs, but we should strongly consider adding movements in our other planes of motion so that we do not significantly overtrain one plane over the others. Training in our other planes of motion with side-to-side movements, so that'd be our frontal plane, and rotational movements, which would make up our transverse plane, can ensure that we have balanced training and stabilization through our core musculature. Most people think when it comes to pain or an injury that we need to stretch that joint. Well, when it comes to stretching a joint, and SI joint pain specifically, we're often not trying to stretch the joint itself, but rather release the tension of the musculature that's too tight acting on the joint. Some common muscles that we stretch to relieve pain in the SI joint are going to be our hip flexors, our glutes, our lats, and those ropey muscles along your spine called your erector spinae. Stretching these muscles will often release the tension that is causing extra compression or uneven pressure on the SI joints. So I'm going to give you 3 stretching exercises to relieve your SI joint pains. The first exercise is going to be our hip flexor stretch. This one's going to be in a running lunge position, okay? So here I'm using a foam roller just to help myself stay upright. What we're trying to do here is not hyperextend our back, so we're trying to pull the glutes down, pull the rib cage in, and squeeze that and rock forward. This is going to stretch the hip flexor on the front, which attaches to the front of the lumbar spine and down to the front of the hip. So the hip flexors attaching from the front of the lumbar spine down to the front of the hips, if they get tight, they're going to pull the pelvis forward, and that's going to cause compression on the SI joint in the back. So especially if you sit all day, this stretch is going to be for you. What I want you to do is hold this for at least 90 seconds, and then we're going to switch sides. And do this about 2 to 3 times per day, maybe more if you're sitting at a desk. Our second exercise is going to be our seated glute stretch. So for this one, we're going to sit with a tall neutral spine. We're going to cross one leg over, and what I'm going to do is hug my knee and pull it across to feel the stretch in the glutes here. Now the reason why this one is important, because if these glutes get stiff from sitting all day, what that's going to do is pull and create more pressure, and that's going to create irritation on the SI joints. So if this stretch is a little too aggressive for you, you don't quite have the hip mobility, or the glutes are just a little bit too stiff, we can start by just this simple figure 4 stretch, putting a little bit of pressure here on the knee. This is going to achieve some glute stretch as well, but be a little bit less intense than this one where we pull across the body. For this one, I suggest doing about 60 seconds, so a minute per side, for every hour that you have to sit during the day. So say that you work 8 hours a day sitting at a desk. What I suggest to my patients to do for this one is do a minute per side at the top of every hour. So our third stretch is going to be a lat stretch. This one we typically do on a rig or a doorway. I'm going to demonstrate on this bench here for you. So what we're going to do, turning your hand down, because that's going to be an internal rotator here. We're going to grab on the edge of the bench, take a step back with the same leg. What I want you to think about doing here is tucking your rib cage down and tilting the pelvis backwards. This is going to stretch that lat because it goes all the way down to the hips. Okay, so then we take a step back here. And this one, what I want you to do is hold this stretch for about 10 big deep breaths, trying to expand out the back this way and feel that muscle stretch. The reason that we need to stretch the lats for the SI joint, a lot of us have tight lats that'll pull our hips because we don't realize that runs all the way down to the back and pull our hips into extension. Okay, if that pulls our hips into extension and we walk around like that or lift like that, that's gonna cause compression to the joints. So say that just one side of your SI joint hurts, let's go with the right side. If that right side hurts, we wanna focus more of our stretch on the left side lat. Those fibers come down obliquely across the lower back, and that's gonna pull and create pressure on the opposite side SI joint. So we're gonna stretch both, but maybe favor the left-sided lat if your pain is on the right side. So if your right side SI joint's hurting, let's give it an extra 5 breaths on the left-sided lat stretch. All right, so now we're gonna move on to exercises to help strengthen your SI joint. So the first exercise we're gonna do is an SI joint reset exercise. Not necessarily a strengthening exercise, but it's gonna be a contract, relax exercise that can help bring alignment back to the pelvis and ease a little bit of that tension that's on the SI joint. So what we're gonna do is come down to the ground. You're gonna lay on your back. And what we're gonna do here is bring our legs up to 90 degrees, knees up to about 90 degrees, and we're gonna use one hand to push on our femur and then our other hand to pull on the knee. And what I'm gonna do is push here and not let my knees move. And I'm gonna hold this for about 5 seconds, and then I'm gonna switch. 5 seconds, and then I'm gonna go back. And I'm gonna do about 10 reps each side. What I'm doing here is I'm contracting the muscles on the front of the hip on one side, muscles on the back of the hip on the other side, and as I go through 10 reps, it brings a little bit more of that alignment back to the pelvis. So then moving on from there, what we're gonna do to finish off this sequence of this exercise is grab a foam roller, a dodgeball, volleyball, something that is about hip width apart for you, and you're gonna lay back on your back, you're gonna put this between your knees, and then all I'm doing here is an isometric adduction contraction. So I'm squeezing my knees together. You may feel a little bit of pop in the hips. That's totally fine, should you bring you a little bit of relief. We're gonna squeeze for 5 seconds, relax, squeeze for 5 seconds, relax, and do that for 10 reps as well. And that completes the sequence of that first exercise. All right, guys, so our second exercise is gonna be called a dead bug. This exercise is very commonly prescribed and sometimes can be done wrong. And if we don't do this correctly, it can actually cause a little bit of pain to the SI joint. So let's take this slow and talk through it, okay? So this one, we're gonna be on our back again, bringing our legs up to 90 degrees like we did before, and then our hands up as well. Key here is not letting this low back come off the ground. So push that low back into the ground as hard as you can, and then what we're gonna do, this will be the most difficult progression of the exercise, is you're gonna be moving opposite hand and opposite leg. Reach it only as far as you can with keeping the low back on the ground. So if you feel that come up, stop there and come back, okay? And then we're gonna alternate, go to the opposite side. That's 1 rep, we're gonna do 10 reps. If that's too difficult, we're gonna start with just a hold. So you're gonna come to this position, push your low back into the ground, activate those abs, hold here for 10 seconds, relax. You can relax all the way down if you need to, and then come back, and we're gonna do 10 seconds for 10 reps. So for this exercise, let's try to do about 2 to 3 sets with about a minute to 90-second rest in between. So for the dead bug exercise, what we're trying to achieve is better core stability, and we're also trying to push that low back into the ground to get a better hollow position. Both of those things are gonna help bring a little bit better support to the SI joints, and then as we move through opposite side limbs of that exercise, we're gonna get better at disassociating those limb movements, just like when we're up and walking or moving around, so that we're not putting so much pressure on the SI joint. Sometimes you don't feel focused and alert in the gym, and your workout can suffer as a result. New Alpha Brain pre-workout was designed specifically for athletes and gym goers and supports focus, power, and endurance. It's the ultimate way to charge up your mind and body. Use the coupon code GETONNIT to get 10% off Alpha Brain pre-workout at onnit.com. Now let's get back to the video. So our third and final exercise of this video is gonna be standing hip abductions. So abduction is just a big fancy word for saying taking our hip out to the side, and our glutes are primarily in charge of that motion. So what we're trying to do here is strengthen those muscles so that we get a little bit better hip stability and a little bit better stability around those SI joints that are irritated. So for this exercise, we can use a foam roller, we can use a rig, we can use the wall. All we're trying to do is find something to stabilize ourselves against. Get yourself feet right under your hips, little bend in the knees, and we're doing about 20 to 30 reps where you're taking your leg straight out to the side. What you're gonna feel is this muscle on this side's working to basically stabilize your hips, and then this muscle on this side of your hips is working to concentrically abduct your hip. So we're working both sides of the hips and strengthening both of those glutes to bring better stability to both sides of the SI joint. So for this exercise, we want to shoot for 20 to 30 reps per side. Take about a 60-second, 90-second break in between and do about 2 to 3 sets. So if you guys have one of these bands or a band that we can tie, let's put it either around the ankles or the knees to make this a little bit more challenging by giving yourself a little bit of resistance. When we discuss the best positions for sleeping, I often recommend sleeping on your back. We want to think about putting our joints and tissues into positions that are not putting stress or tension on them while we are sleeping. While dealing with SI joint pain, typically sleeping on your back with a pillow underneath your knees to alleviate some pressure and some tension on that lower back is going to feel most comfortable. Sleeping on your stomach will put your lower back into more extension, and that will likely aggravate your symptoms as it compresses the SI joint. With lower back pain or SI joint pains, it is important that we do not let these pains make us sedentary. So when you're in pain, you want to decrease aggravating stressors to let the irritation subside and allow the tissues to heal. But we must keep moving to encourage that healing. Remember, motion is lotion for our joints. Specifically with the SI joint, we often want to limit any movements that are going to put our back into hyperextension, because that's going to compress it. Hyperextension is when we go into excessive lower back curvature. So lumbar lordosis is normal. We want a little bit of that, but as we go into it too much, we start to compress all of those joints on the back. So do your best to avoid things like cobra poses or similar movements until the pain improves. We also may have to avoid movements with excessive hinging, such as deadlifts and kettlebell swings, just while we let our SI joint pain heal. But I always suggest my patients go by feel in these situations. We may need to decrease range of motion while dealing with SI joint pain as well, such as lifting from the blocks rather than lifting from the floor. But as long as we can maintain a good brace in our core while lifting, we can often train with SI joint pain. So let's take deadlifts, for example. If that's going to be a challenging exercise and it's painful for you to get all the way to the ground, let's start with that weight elevated and let's do a slow eccentric RDL. Don't go into pain, just kind of touch right before you feel the pain and come up. So reduce the load, reduce the range of motion, but still continue to train. SI joint belts are designed to take pressure off of the SI joints and their ligaments. It is true that SI joint belts can help alleviate pain and help with the healing of acute SI joint pain. Though I rarely recommend using any piece of equipment to the point of reliance. So with that being said, if we can use the SI joint belt while dealing with the pain in the short term, all while we are continuing to work on our rehab and stretching exercises to develop better core and hip stability, then that is completely fine. So long story short, SI joint belts are totally fine in the short term, but remember, we don't want to rely on them and we want to continue to work on our exercises in the meantime. Thanks for watching, and if you like this video, please give it a thumbs up and subscribe to our channel. Also, click the link in the description for a full article guide to SI joint stretches and exercises to relieve some pain. And give me a follow on Instagram at LanePalmDC, and if you're in the Austin area and dealing with some pains, come see me at Onnit Gym.